If you're working third shift, you're setting yourself ablaze. And that fire that's burning internally could kill you early. In today's video, I want to show you an example of a patient in my office who's a nurse working third shift, working overnights, and the drastic difference in her labs from before she started working third shift to 6 weeks into working third shift. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Let's dive into her case. But before we do that, please hit that subscribe button and click the notification bell so you can get more informative videos like this to help you live an optimal life. So as I said, we're talking about a female 31-year-old who is a nurse. So this is a 31-year-old female nurse. And this patient first presented to my office looking for help with fatigue, with celiac disease, and with hives. And there's a lot to this case. I'm not going to get into all the different details today. I'm going to stick to what's relevant for the third shift sleep deprivation, artificial light at night information, and go over the rest of it some other time. And to that point, if you want to learn more about this topic, how third shift damages your health and how artificial light at night is not good for you, check out my Amazon International best-selling book, The Autoimmune Answer. I discuss this more in chapter 10. This is what she presented with from a diagnosis standpoint. From a lab standpoint, here are her initial labs, the relevant markers for what we want to discuss today. First, she had a positive ANA test, anti-nuclear antibody screen. And that is a predictor for autoimmune disease risk. It's also an inflammatory marker. If you want to learn more, check out a previous video I did on this topic on my channel. She also came in with a lab high sensitivity C-reactive protein. C-reactive protein is medicine's favorite inflammatory marker because it's an independent risk factor for cardiovascular disease. They call it CRP for short. This woman also came in with a functionally low vitamin D. And that is important because vitamin D is a key anti-inflammatory, antiviral, immune system modulator, bone health, muscle health, keeps barriers tight, not leaky, all that stuff. So we need a good vitamin D level. Hers was not. And then she also presented with a lab high homocysteine and lab low iron. So the lab low iron could contribute to fatigue, of course. The homocysteine could contribute to fatigue. It could contribute to brain fog and memory loss and other things. It's also a significant risk for cardiovascular disease and dementia. So these are inflammatory markers. These are what she came in with diagnosis-wise. And so let's talk about where we got in 6 weeks. Okay, we put forth a 12-week plan for her, and I reevaluated her at 6 weeks. And so at the 6-week mark, her anti-nuclear antibody screen, which was initially positive with a 1 in 80 titer, at 6 weeks was now negative. So that's a big win, okay? That means that we reduced her risk of autoimmune disease and we reduced her inflammation level and connective tissue damage. Her CRP, we said initially, her high sensitivity CRP on initial test was lab high at 3.4 milligrams per liter. And at 6 weeks, it had improved to normal range at 2.11. Okay, so that's a significant reduction in systemic inflammation and cardiovascular disease risk. And then on the initial test, her vitamin D was functionally low, we said, at 40.3. And at the 6-week mark, our goal for her was 70 nanograms per milliliter. She surpassed that and hit 84.8. So her vitamin D had optimized for us. Her CRP was normal and her ANA was optimal. Okay, I like less than 1 for optimal in the CRP, but this is within normal range on a LabCorp test. Less than 1 is still my goal, but you can see the trend. She had significantly reduced her systemic inflammation. She'd eliminated the connective tissue damage that was driving inflammation and autoimmune risk, and she over doubled her vitamin D, which again is a massive anti-inflammatory, so helps drive both these down. So at 6 weeks, she's feeling good. Her anxiety was 50% reduced, which she had related to fatigue and things like that. Her fatigue, her energy had improved 25%, she reported. Her brain fog had reduced 50%. And some of that is because of this. Some of that is because we optimized her homocysteine at 6 weeks. It was now normal. Her iron had improved at 6 weeks. And so overall, she's looking great. At her 6-week visit, she drops a bomb on me. She says, "Doc, my hospital now is moving me to 3rd shift and I don't have anything I can do about it because we're short on nurses." That broke my heart for her because, as you can read in my book, as you can read in the research, sleep deprivation destroys your health. And we'll put up some studies here that you can refer to on that. But sleep deprivation increases inflammation, increases viral risk, increases risk of atherosclerosis and diabetes because it increases systemic inflammation. Okay, so I was bummed, she was bummed because, hey, she'd gone 6 weeks, made great changes, and now she's got to go work 3rd shift, work overnight shift as a nurse. And I said, that's a bummer, but if you have to keep that job, you know, life happens. So the cool thing is we have numbers before she headed into that, because she was starting the next week after I was seeing her. Now we've got numbers after 6 weeks of overnight work, and we can see what happened. And it's not good. She's inflamed. Working overnight, circadian rhythm dysfunction associated with that, the sleep deprivation associated with that, has led to increased inflammation in her. So now what we can see after 6 weeks of overnight work, the ANA is now positive again. The CRP is now lab high at 5.1, okay? And that's much higher than it was initially. And her vitamin D has dropped down to 49.8. So explain that. Well, the overnight work, the sleep deprivation has driven up her inflammation, as the research shows that it does. So we're seeing that. And when you're more inflamed, you have to use more of your fire extinguisher to work to put the fire out. So the higher inflammation has taxed her vitamin D level. She's used almost half of it to try and keep these numbers at bay. And you can see that's not even keeping her at bay because these numbers have gone up despite her using her fire extinguisher. So if you work overnight shift, 3rd shift, whether you're a nurse or a factory worker or just a night owl, that is killing you. That is killing you slowly or quickly, depending on the rest of your physiology and your lifestyle. But it's increasing your systemic inflammation, which increases your risk of diabetes, atherosclerosis, cancer, dementia, all of that. So if you can change your habits, if you can change your job and move to 1st or 2nd shift, I implore you to do that as quickly as possible. And if you need other strategies on how to deal with this stuff, check out my book on Amazon and check out other videos I've discussed on sleep deprivation on my channel. Thank you for watching. Have a great day.